want to be respectful of people's time as well, and we have a lot to cover. I had mentioned this in the email that I had sent out, but we will make this a two-part series just because we just won't be able to fit it all in. So we'll see how far we get today, but our focus for today is going to be more lower body. Make sure if you have a foam roller or a tennis ball or a rolling pin, you can certainly follow along with me throughout. Some housekeeping things that I was mentioning just before is Amanda's going to manage the chat feature. So if you have questions while I'm doing demonstration, I'm taking the first couple of minutes here or so to just go over some slides and a little bit of background as to why should we foam roll or do self-myofascial release, and then we'll get more into the demonstration part. So you'll see slides for the first half, and then you'll be seeing me doing more on a bigger screen for demonstrations. I also want you to be aware that I do have a slide deck. I'm not going to show you the whole slide deck because I created it more so it could be like a handout to you that you can reference after this presentation. There will also be a YouTube link to a video I had filmed in the past that, again, you can use as a reference, and a newer one that I did all with the tennis ball. So there will definitely be resources for you to follow along and practice on your own. So without further ado, welcome to Roll and Release. I'm Jamie Shepke, if you haven't had me for classes or we haven't communicated with each other before, so I appreciate you taking time out of your day to learn more about self-myofascial release and how it can be a benefit to you. So let's dive in here. I want to cover like what is fascia, because that's essentially what we're working on when we're doing self-myofascial release. So each part of the body like is connected by fascia. So I want you to think about like as an imagery here, it's like a sweater or like a spider web. So it should be like nice and loose and wavy and pliable, and that's why we should be able to, you know, stretch and lengthen our muscles and joints and everything. And so what happens is when we have trauma or injuries, like whether we have like a car accident or we have surgery or maybe just habitual poor posture, that tends to make the fascia really tight and restrictive. So like another imagery that you could think about is, I guess, think about like your hair, right? Like if you have dreadlocks, when you're not constantly brushing and washing out your hair, like it gets really tight and restrictive like that. Or if you think about like a rubber band, when you're pulling a rubber band, it's very like pliable and loose. But when you tie a knot into that rubber band and you pull on both ends, it just gets tighter and tighter. So that's what happens to our fascia, and that's why it's super important to take time and to really, when you approach your health and fitness routine, stretching and doing myofascial release like this, it should be part of your training. Like your muscles need the opportunity to recover from the stress that we put on it, the good stress that we put on it through exercise, or some of these, like some of the bad stress that could happen through your poor posture and just some of the trauma that you may face. So I want you to be aware of what fascia is and why we're focusing on it. Okay, and we're going to move on. So what causes muscle pain, soreness? Okay, so we covered poor posture, right? So I was just talking to the girls before this, but like for poor posture in terms of where maybe, you know, because this is more of a corporate environment, now I know we're probably working from our home offices, and maybe they're not as ergonomic as your office at work. So, you know, is it that you have more of that rounded posture, or, you know, are both feet flat on the floor, or do you cross your legs a lot, right? Like that's going to restrict some areas or muscles, and some things are going to get a little off because you're putting more weight into one side and so on. So that's definitely something that's going to affect that. Repetitive motions. So again, like if you think about, I'm going to do like more of a sports analogy on this one, but pitchers are always throwing with, you know, whatever arm they're right-handed, they're always throwing with their right arm. Or for me, like I have a toddler and I always put her on my left hip because I'm right-handed, so I like to do everything else, multitask with my right hand. And so I'm putting more weight into my left hip, and that makes things more tighter and just makes things off balance, right? So you just want to be really mindful of like what repetitive motions you're doing. Dysfunctional movement. So even like when we think about like our classes, so when you're doing a class and if you're not moving in the correct movement pattern, there can be risk for injury, or you can strain something because you're not moving at a way that's making you get the full effect of the workout or the exercise, or just in general, like any activities of daily living. The other thing with repetitive motions that I wanted to hit on is training in all planes of motion. So again, if you're always doing, like for those that love to run or to cycle, you're always in the sagittal plane, like right here, it's forward and back. Whereas, you know, in some classes and cases, like you want to do more like lateral movements, like lifting the arms and legs out to the side or going across the body. Like it's important to train in all planes of motion. Overtraining comes to where you're training too hard for too long. And again, part of your training should be stretching, rest days, or again, just taking this time to work out those tight muscles, okay? And I love this quote, like, the best posture is a variable one. So especially throughout the day, like get up, move around. Our bodies weren't meant to sit. And when you think about when you're sitting, your hips are in a flexed position and they weren't really meant to do that. And so that's why your hip flexors can feel really tight when you're doing exercises like bicycle crunches or like anything putting your leg away from you. So it's just really important to just keep moving. A body in motion stays in motion. Okay, so let's keep that in mind. The other thing is with posture too, like everything, if you think about it, is out in front of us, right? So you know, when we're typing, you know, you're almost kind of like leaning forward unless you're really good at like pulling your shoulders and retracting your shoulder blades back, or the text neck, like your head, like that's so much weight and stress on your neck when you have like a forward head posture. So all things that we want to keep in mind, and we'll cover more of the upper body and posture stuff in our next series, but I still want you to be aware of it here. Okay, continuing. So from here, why use self-myofascial release? So some of these were actually just brought up a little bit here, but so indications of why to do it: improving mobility and range of motion. And again, that's going to help us when whether we're moving for exercise or different movements, like we'll have greater motion, which gives us like just more out of the movement exercise. It reduces scar tissue and adhesion. So again, after surgery or again after that trauma, it's super important to like work within the fascia to get in there a little bit deeper. That's why I like, you know, like the tennis ball is a little bit more dense, and we'll talk about like densities and stuff, but it helps get into those tight areas. It helps improve quality of movement. Once again, like it's just, if you're moving those different planes of motion and you're just keeping everything loose and wavy, like that sweater or spider web analogy, like that's where you're going to see the bigger difference. And then when you do self-myofascial release, it can serve as the gaps between deep tissue massage. So maybe massage isn't like feasible for you, or you're just not able to do it on a regular basis for it to be maintenance, but this could serve as that. It can serve as that maintenance in between having somebody actually do manual work on you. Now, some contraindications that you want to be aware of is any like recently injured areas. You want to avoid that, like acute injuries. To put this like pressure on that just isn't good for it. Chronic pain conditions you have to be really aware of. And then as well as like bony prominences like joints, abdomen, the head, or like armpit area, we want to avoid those. And I'll get to that in terms of like placement when you're on the foam roller and when we do the demonstrations. It's just very important to be aware of that you're not on those bony parts. A couple of other contraindications, and I can provide some notes when I send out some of the handouts, but osteoporosis, diabetes, high blood pressure, varicose veins, like putting that pressure on those veins and blood vessels isn't always, like it's just something to be really mindful and aware of, and I'm going to follow up with that too because that was brought up. Pregnancy, injured bone or soft tissue, and then any condition of which you're just unsure. Like if you're unsure, if you're not, shouldn't do it, ask or consult your doctor and then move in from there. But I'm definitely going to go over the lower body today. And then again, I would just say like let pain be your guide. Okay, it's definitely going to be uncomfortable. We want to be able to use our breath in some of these movements because it is going to be a little bit intense, but I don't want it to be painful. And I'll cover like density and stuff like that because I think that comes into play with that. Okay, so just a few more of the benefits of foam rolling. It's effective and it's inexpensive and convenient. So in terms of like inexpensive, again, instead of maybe getting a massage every month or wherever it may be, you could do this in between that. I think mine was like $40 when I had gotten it from Dick's Sporting Goods, but you know, tennis balls. Usually everybody's got a tennis ball at home, right? So you can use that. You can use a rolling pin. It's convenient because sometimes you can travel with it as well. And I know this one's bigger, but they come in different sizes. I even have like this smaller one too that I could, you know, stick in the car or a bag or something. It increases blood flow and improves range of motion. It decreases muscle soreness and relieves joint stress. Increases ability to stretch and for the muscle and the tendons and tissues, and then maintains normal functional like muscular length. Like you just want to think about again, like when your muscles are loose and wavy, you're just gonna be able to have better movement quality, and it just helps you with those activities of daily living that are just important to be able to perform. Okay, so a lot of great benefits to foam rolling. We're also kind of mixing foam rolling and trigger point a little bit here, but just so you're aware of those. Now these are last slides I really want to cover in terms of factors to consider before I show you the movements that we're doing. So positioning, poor alignment in terms of when we set ourselves up in some of these rolling techniques, you do have to support your body with like your arms. Okay, so for instance, and I think I'll still show it to you when I'm down there, but still having your shoulders over your wrists, like you want proper alignment that way, or using your core to support you. And there's another one where we kind of are like hovering on, well, not hovering on the roller, but again, alignment's important, and proper placement. So again, are you placing pressure where it shouldn't be, like on any bones? And there's some other, like when we get to the inner thighs and stuff, we just got to be aware of, or like improper placement on the knee, like you never want to roll over the knee joint, like above or below it. So techniques, there's rolling, which again, like you're rolling the roller, okay? There's cross friction, think of it like friction between your hands. So essentially you're on the roller and you're like going side to side with your, these will make more sense when I do them on the floor, but, and then spanning is the roller doesn't move, but my body moves like side to side. And then pulling is, if I'm pulling like the tennis ball, pulling it down and up, and then pivoting is more of just a circle, like a circular movement. So those are just different techniques that we'll cover. Now some ask like, well, how long should I do this for? So typically it's recommended by trigger point therapy that you work in terms in sets of 4 reps. So, and that means like if I'm doing my quad, let's say my thigh, I'm going to do 4 reps like on the upper part of my thigh, and then I'm going to move to the next section. I do like kind of like work in inches, so I do 4 reps back and forth. Or if you don't want to keep track of reps, you could also do times, so like 30 to 60 seconds, and that means like the whole leg, so like taking 15 or 20 seconds on one, and so on, or maybe less. And then pressure is another thing that we'll focus on. So you can stand up and place more pressure using gravity or your weight of your body. So like when we're going to start with our feet first, because we're going to go work from the ground up, you can stand up and do it. Or you can stack your legs and have more pressure that way. That'll come into like the calf work that I'll show you. This came up as a question too in the email, but density. So these two I would say are even different in density. So this one's a little bit softer. This one's a little bit harder. If you've been, I don't know if you can see that. If you've been to the facility, we actually have ones that have like lugs or grooves on them, and it's very intense. So just be aware of density. So if you're new to this or you haven't done it a lot, I would suggest going like with a softer cushion first, because I don't want it to be too aggressive and then you're super sore or in a lot of pain, and then not want to do it again. So always start with a softer density, and then if you're like, oh, okay, that's not too bad, or oh, I could go a little bit further or go a little bit deeper, great. Then pick that. And then the size of the foam roller, again, it kind of depends. So like size would be like, again, is it convenient to take? If it's something that you want to take with you on the go, maybe a smaller one would work. Now this one is hard. I really tend to only use this one like for my inner thighs because it's easier to place like for a body part, but I tend to like there's some that are like kind of half this size. I like this one if I'm going to lay on it. It's just it's more versatile to utilize for everything. So that's a little bit quick, brief detail on those factors to consider. Again, you're going to get this slide deck, so you'll have all of this, and we'll go over it while I'm going to go through the movements. So moving along, because we got a short period of time, so about halfway through. Again, a reminder, if you have questions, I'm going to stop sharing my screen. Oh, 1 second. Actually, let me cover this quick. So just a couple of tools. So a medicine ball you can use. Again, it's a little bit more dense, but you can certainly use it for like glutes if you're rolling around on your glutes. The tennis ball, a softball, is going to be a little bit more harder, and it's smaller too. A golf ball can be very intense because it's very hard. So be mindful once again, but if you're looking to get a little deeper into some of that fascia and the muscles there, that's something you could use. This stick is actually like a brand. So I don't have the stick, so I grabbed a rolling pin and it works just as well. And then the foam roller is the other thing. So I just have a couple of release tools there as well. You can get them, I'll cover that at the end, but you can get them at any like sporting goods stores and online. Okay, so here's our outline. We're going to go work from the ground up. Feet, shins, calves, and so on. And we'll see how far we get in about 15 minutes. So again, questions, throw them in the chat box. If there are any, Amanda, right away, just let me know. Otherwise, I'm going to unshare my screen here. And then I'm going to move my, there we go. Oops, hold on one second. Okay, I'm going to go into spotlight view. Can you see me? Yes. So, first things first with the feet. Put this over here. Hopefully you can see me. Okay, I'm going to back up. So we're going to start with the tennis ball first. You see that, I think. Okay. So if you're doing this along with me, I am barefoot right now. So what you're going to do is, and not every muscle that we touch on, we're going to do all those techniques, right? So we're not always going to do spanning or cross-fiction with all of them. We're just going to do ones that makes the most sense for that part. So with, maybe I'll go from this side. So with this first one, I'm going to, whatchamacallit? I'm going to squeeze, and then I'm going to flex. And I'm going to squeeze, and I'm going to flex. I'm just going to open up the chat here for a second. So, oh, she's not seeing anything. I only see a very small box. Can everybody else see me? Click on hide stage. Where's that?
I can see you, Jamie. That's
okay.
for them.
Oh, okay. Just want to make sure.
Click hide stage, yep.
Perfect. So you're going to squeeze and flex. So I'm like on the top part of my foot right now. So I do about 4 reps there. Okay, once that feels good, you're going to go into like the arch of the foot. And again, if this is painful, if you're having like plantar fasciitis and things, that could be like a contraindication for injuries. So just be mindful of that. So you're going to flex and squeeze. Okay, so I've done that. The heel is more, I do like more heel pumps. So I'll just press my heel down into the tennis ball. And then here I'm going to roll it. I'm just going to roll it back and forth a couple of times. And if I had more time, I might go and do another couple reps, flex and point, and then roll. And once you do one side, what I like to assess with this one is, okay, can I reach down like by my knee or past my knee? When I do the other side, I'm tighter. It's very interesting how that's different. Or if I do like a calf raise, I feel more, I have more length in that foot that I just did. And then of course, you would do the other side. Okay, so I always work both sides of the body, point and flex, and then roll, and so on. So I'm going to make this one a little bit more brief, but I love doing the feet. Like I love doing this even in the morning just to get things moving, or at night, because your feet support you throughout your entire day. Like your feet are your foundation, so we need to take care of them, right? So that's what I use for the feet is a tennis ball. So point and flex, and then roll on the foot. Do that a couple times. Do it in the different parts of the foot, okay? Then from there, we're going to work into the shin next. So the shin. I'm going to go with the rolling pin first, but I will show you how to do it on the foam roller. Now, if you had like a chair, again, I'm not going to do it directly on the bone, but I'm going to take it, and then I'm just going to roll it. A couple reps, like about an inch or so, and then I'm going to work down. Actually, sometimes I think I tend to do it up first, so from the ground up. So I'll do lower, and then I'll go up a little bit more. And so I work the outer part of the shin first. If you have any in the inside, you certainly can do that. Again, it's a little bit more of a bony spot, so you got to be a little bit mindful of that because then you're working more into the calf. So again, I just like to work in those little spots. And then you can apply the pressure here as well in terms of like how hard you press down. But again, avoid the knee joint. Any questions so far? Let me know. Let me show you the foam roller for this. So this is again where like alignment comes into place, and I just want you to be aware of like trying to keep your shoulders stacked over your wrists. So I'm going to work it again to the outside of the calf. So it's almost like you're in like a bear crawl-ish, but I'm at a little bit of an angle, okay, and I'm hovering my toes off. Now this can be a lot of pressure on the shin, so you got to be really mindful of that. You could have that back foot down and that wouldn't be as much pressure, so there's different ways that you can work that. And then again, I'm starting with those 4 reps, And then I'll go a little bit further down the leg. So if you need to adjust your arms, feel free. Can be somewhat of a workout where you got to support yourself in these movements. Okay. Now you could do the spanning. So again, the foam roller stays in its place, and then I'm just moving my body side to side. Okay. So that's a different way to get into the shin. And again, you would want to work both sides. So I'll just briefly show that. Here, forward and back, and then that side to side. So sometimes I work in like 3 sections. It just depends. And then I want to work into the calf muscle next. So I did show this a little bit, but you can use, again, I can have my foot up on a chair. I can be seated. That's probably a little bit more comfortable. And then just working that rolling pin down my calf. So I do kind of the outside, and then I'll work like right behind the calf. So certainly if you're a runner, like your calves, your shins can take a lot of the brunt of the work, especially if you jump a lot too from a high intensity jumping workout. It's important to just massage out the shin. So 4 reps there. You could do a little bit of spanning with the roller, but your leg wouldn't move on that one. Then with the foam roller, again, this is one that you would have to support yourself. So and these directions are in the handout, but you would lift your butt up, and then you're working, I'm going to switch back a little bit, 4, 3, 2, 1, and then I might just scooch up, and I'll do the next section. Now with this one, that might not feel like enough pressure, so what do? You stack your joints. I lift up, and now, yep, that's different. Okay, and then we're spanning with this one, side to side, like so. Friction is hard. Friction is going to work a little bit easier on like the IT band. That I'll show you that one. Spanning, and then forward and back. So now I'm flying through these a little bit quickly, but again, if you're doing the single leg, just make sure you get the other side. So where are my joints? Shoulder or the wrist. Core is engaged. You get some good core work out of it. Okay, so we got the feet, the shins and calves. Next, we're going to work up into the hip flexor. This one's a big one if you sit at a desk all day. Like when your leg is bent, your hip is flexed. So you want to create length. Like one that we do in class is to do the low hip flex or like low lunge because you're opening up your hip flexor. So that's what we're going to try to do this one. So this is where it gets a little bit, not tricky to say, but to set yourself up. So essentially I like to be on the edge of the foam roller, and then it's like right here in front, and I'm going to lay on it. I'll show it from the other angle in a second. And then I bend this leg just to give me, I can actually use it. So and my back foot is like helping me go forward and back, okay? So sometimes this can be really intense for this muscle. So just be aware of that. For spanning, my leg, I lift the foot off of the floor, and then I shift my leg back and forth. So that's how I do that one. Let me just show you from the side real quick. So you're here, and then forward and back. So that works to lengthen the hip flexor, the front part of the thigh. You can also use a tennis ball, and I find that spot in between like my pelvic bone and just at a slight angle in the front, and then I lay on it, okay? So real quick, I lay here, and I come down, and then I would work like little cobra stretches. So I'm pressing into the tennis ball as like I pull myself forward up into that like cobra stretch. And that gets into that muscle a little bit deeper, okay?
Hey, Jamie, I'm really sorry if you already covered this because I was late.
You're good.
With the foam roller for that, how far can I go down on my leg before I'm like, getting into my knee joint?
Yeah, so that's a good point. We're going to go into quads next. And so, yeah, you would probably want to start just above the knee joint, okay? So, yeah, you could work your hip flexor first. And so why don't we do that next is we'll go into the quad because you're already in that position that you can start to roll the quad muscle. So you would go just about, just give it like a couple inches above your kneecap so you just don't make sure that you don't go too far. That's a good question. So for the quads then, you're here, and this again could be where you do 2 legs stacked on top of each other, or 1 leg stacked on the other. So now that's going to increase more pressure on my quad, okay? Now I'm on the edge. You don't have to be, especially if you're doing both quads at once. You can be here, okay? Or I stack the leg and I'm here. Now this is where you can get more different techniques So I can do the spanning. I might just do even this. Spanning one leg. I can, oh no, I'm sorry. That was cross friction. This is spanning when I go side to side. That really feels really intense there. The other one is, it's going to be hard to see a little bit, but I'm just bending my leg and extending. That's a different way to do it. And again, this could take a bit just because you have to get into the different parts of the quad muscle. So again, I'm stopping before I get to my knees. And again, this is the cross friction one. Just to say, for the sake of transition, I'm going to transition right to the IT band real quick. So IT band is the lateral part of the thigh, especially if you're a runner. That one can be pretty tight. So what I do, and I usually like to be up on my arm, just gives me more like way to move. On this one, I don't go all the way up to my hip joint. I'm just a couple inches below that. Then I bring the top leg in front and I set it down, back up a little bit because I can't see my foot. Okay, there we go. And so then again, at my bottom leg or foot, I flex it here just so it stays active. You can just relax. I mean, it's not a big deal if you don't do that part. Okay, so a couple reps there. Then before I move on, cross friction, forward and back. Spanning, I might just move a little bit forward and back or side to side, like so. Okay, and then you can also, oh man, this one's so tight. You can also bend and extend there, okay? Then you move a little bit more, and you might find that you're not as tight in that one part of the IT band, but the lower you get to your knee or whichever, it might be a little more intense. Another thing that I want you to keep in mind, please remember to breathe. When we get uncomfortable, we hold our breath. You want to make sure that you're using your breath to help you, okay? Okay, so we got quads, IT band, and then glutes. Since we're in this position, I'm sitting on the foam roller. You're going to come on over. So again, you can have both glutes here. My arm's just here to support me. Now I'm going to start more towards almost like my low back a little bit, and then I'll work here. And then I'll come forward a bit. Just be mindful again of any like bony parts there. I actually like to work my piriformis, which is more the outer side of the glutes. So how you get into that is you're going to cross the top leg on one leg on top, and then you can shift towards the side. You can add a little pressure of just pressing that leg away. So again, you have to kind of support yourself with one arm there, but be mindful. So you're rolling. Then the spanning again, side to side, so the roller stays in place. Cross friction would be a little bit more challenging to do on this one. Okay, you can also roll like while this leg is on top. I even like to roll and do this on the other side before I switch the legs that are on top. So it just is working a little bit different part of the muscle. And again, I go in 4 sets or keep time for that 30 to 60 seconds. And then make sure that you switch and do the other side, okay? And again, spanning and so on. So that one's a really good, especially, our glutes just serve us in many different activities of daily living and classes, so it's just helpful to make sure that we loosen them up because everything, like our hips are tight and such, and that helps. Then hamstrings, I want to make sure I get you that real quick. I know we're getting close to the hour, it just flies by, it's crazy. So hamstrings. Both here. How would I intensify it? Again, stack the leg. Cross friction, a little bit more challenging because you're just trying to support yourself here. And then spanning, you can definitely do on this one where you roll a little bit. I also have used the stick for this as well. So I'll go here and then I'll roll out the hamstring that way. All these moves you can also use with a tennis ball. So I have 2 separate videos I'm going to send to you guys that I literally am I'm doing the exercises with you and I'm counting out the reps. So I think that will be helpful for you. But here I get at least a hamstring. And don't forget like the outer part. I work in different sections. I don't like to do a whole, just do the bottom half. But try to get around the whole muscle there. Okay, I think I got what I wanted to get through at least with the lower body. So as I mentioned, we will definitely follow up and get the upper body to work the posture of the chest. We'll do the neck and traps and everything as well. So I'll send the follow-up. This was recorded, so you can go back. I know it was really hard to get through all that. We had to go through it kind of quickly. So 4 reps as a forward and back, working your spanning, 4 reps, cross friction was moving back and forth. So any questions that you have in the chat, throw them in there for me. Please let us know any feedback. For sure, I think it's helpful to have the follow-up video along with me. And please, I'm available. Send me a Skype or an email, and I can follow up with you through that. I'll make sure to follow up on the contraindications for you as well. So thank you for your time, and I hope you guys have a great afternoon. You're welcome.